Good day, ma'am. I am Generous Doria, your student nurse from Aralo University. So, for some verifications po, may I know your name po?
Christine,
Okay. Ma'am Christine, when's your birthday po?
December 11,
Okay. How old are you?
17.
Okay. So, ma'am, before we start the procedure, I'll be having some quick surveys about you. Is it okay lang po?
Okay.
Okay, so do you have any family history of illness including cancer?
No.
Okay. Do you take any medications po?
No.
How about do you experiencing difficulty of breathing po?
No.
Okay. Do you feel any discomforts like a headache or dizziness?
No.
Okay, that's good. So, ma'am, before we start the procedure, I'll be able to touch some parts of your body, specifically your breast. Is it okay? Okay, that's good. Don't forget to perform hand hygiene and also don't forget to wear gloves. Can you take off your clothes po, ma'am? Okay, ma'am, I'm going to assess your breast na po. Okay, ma'am, the size of your breast is normal. It is round and it is symmetrical, and I don't see any abnormalities like stretch marks or any edema. And mom, your areola is dark brown, but it's fine, it's normal. And your nipple is in the same position or location, and it has the same size. So yeah. Okay, ma'am, for the next part po is raise your arms above your head like this po. And push your arms together and slowly flex your elbow. Okay, wait a second po, ma'am. Okay, okay na po. Then, you can put it down na po. Next po, ma'am, is to press your hands on your hips like this and release. Okay, so ma'am, your breast has no signs of swelling or redness or any dimpling, and also there is no change in outline and shape of the breast. Now, I am going to palpate my client's breast. Signs of suspicious masses, and your bilateral breasts are symmetrical, or let's say it's perfectly normal, and so your nipple are erect, and your breast has no scar and any tenderness. Now, I am going to assess my patient's axilla. Your axilla has no infection. It is discreet, non-tender, and it has a smooth and well-defined margin. Overall, ma'am, you have a normal breast and axilla. Do you have any clarification spot?
Thank you.
And that is how you assess the patient's breast and axilla. And now, we are going to assess the eyes, ears, nose, mouth, and throat. In assessing the eyes, for the first part, we need to check the distance vision. The client is positioned in 20 feet from the letter. Cover the left eye and let the patient read the letter from the smallest line that she can read.
F, C, say, P.
The client should also perform it in the other side of the eye. Now, we're gonna continue the examination of the eyes by looking the conjunctiva. It should be moist and pink. You also need to check the symmetry of the eyebrows and eyelids. The next thing you need to do is to grab a pen and let the patient follow the pen by her eyes, keeping her head still. Now, I am going to assess her ears. For the ears, we are going to look the ears if it's symmetrical. For the hearing test, you need to whisper on the ears and the client should repeat it. And now, I am going to assess the nose. The nose should be symmetrical. Next is look at the septum. And in my client's case, it looks like the septum is in the center where it's supposed to be. Put the one finger on the other side of the nose and try to breathe in and breathe out. As if there's any trouble breathing. For mouth, I see that the lips are pink and moist. So now, I'm gonna look inside the mouth and first, I'll be looking at the teeth. Her teeth are white and the gums are pink and I don't see any gums disease or any inflammation or redness. I noticed that there's any fillings in the teeth, but I do not see any teeth that are rotten. Now I am going to look inside and I'm looking inside of the cheeks. It should be pink and shining with no lesions. The tongue is clean. The tonsils are in good condition and the throat is also in good condition. So yeah, that is how you assess the eyes, mouth, ears, nose, mouth, and throat. After the assessment, tell the patient with your findings and discuss it.